The minority in Parliament says the misappropriation of the funds earmarked for the fight against the COVID-19 pandemic lends credence to its calls for a comprehensive probe into the COVID-19 expenditure. Contributing to the budget estimates for the Health Ministry, Ranking Member Kwabena Menta Akando alleged government spent 107 million Ghana cedis for the purchase of nose masks, 254 million Ghana cedis for the purchase of hand sanitizers, and 197 million for the purchase of tissue. According to the Joboso MP, the Health Minister, Kweku Ajiman-Menu, should be summoned to the House over his inability to justify the use of the monies.
The Speaker, upon critical look at the COVID expenditure, I was left with no option than to agree with the people who are calling for a bipartisan probe into the COVID expenditure. Mr. Speaker, we realize that if you check the 2022 budget, about 573.4 has been allocated as seed money for recapitalization of development bank. The Speaker, COVID money, when we are going around looking for money to combat COVID, the Speaker, we are using COVID money for recapitalization of banks. The Speaker, I'm struggling to see the correlation between the establishment of the bank against COVID-19 pandemic. The Speaker, again, we looked at the expenditure of about 857.6 million, and some of the items are very, very interesting. Mr. Speaker, I'll share a few with this House. The Speaker, we realize that about 107 million Ghana cedis was used to purchase nose mask. 107 million. Mr. Speaker, again, we also realize that about 254 million, and I repeat, 254 million Ghana cedis was also used in purchasing hand sanitizers, Mr. Speaker. Mr. Speaker, the most interesting one, about 187 million was also used in purchasing tissue. 187 million. These are shocking revelations, Mr. Speaker. Mr. Speaker, again, the interesting one. When the Ghana Health Service was educating people for, restriction of movement and what have you, they had spent about 32 million Ghana cedis on conferences and meetings. Mr. Speaker, this is shocking. So, Mr. Speaker, I know that you will agree with me that there should be a proper probe into this matter for us to come to a logical conclusion. Mr. Speaker, again, it must also be put on record that as of the time the agencies were appearing before the committee, we were informed that they had taken delivery of about 13 million doses of vaccines. And out of the 13 million doses of vaccines, what we have procured, what we have bought, what we have used our money for is around 2.7 million doses.
What's his name?